Why is the GP limiting the activity in that situation when somebody's got chronic fatigue syndrome?
Well, the most important reason is because patients with chronic fatigue syndrome get into this all-or-nothing approach to activity. When they're feeling good, they'll do masses of exercise or activity. When they're feeling bad, they won't do anything, or they certainly reduce the amount they're doing. Right. So it's important to develop the consistency, and that means not only maybe increasing the amount they're doing, but also stopping themselves from doing too much when they're feeling quite good.
So having done that, I guess the process really is, it has to be a slow, supportive, steady one, so that the GP's really got to help the person to very, very gradually build up their activities and but limit them initially. Is that correct?
That's right. I mean, I think we're thinking in terms of months rather than weeks. So the GP needs lots of patience,
yes,
as opposed to people, to stick with it over a number of months and seeing the patient maybe once every 2 or 3 weeks to set new goals.
Yes.
And during that time they could discuss any difficulties that the patient's having.
Yes, and to keep the goals realistic, so,
that's
so
important.
really sort of increasing them very, very slowly as appropriate.
Absolutely, and it's really important not to go too quickly.
Right.
It's much better to go slowly and surely
and
get there in the end than to do things too quickly and for it all to go wrong, which is what often happens.
Yes. Now, when things do go wrong, I mean, presumably it doesn't always work this way. What's the point where the GP should be thinking about referral?
I think if you've given it your best shot for about a year, at that point then I would think about why it's gone wrong.
Right.
And if you think a specialist referral would be helpful, then at that stage then...
Yes. Now, what sort of specialist? Because there are immunologists, psychiatrists, psychologists, there's all sorts of people that specialise in this area, aren't there? Who would you recommend? Resources willing, of course.
Yes, I mean, it's extremely difficult, but I think the most important thing is that whoever you refer to, whether it be the immunologist or the psychiatrist, that they're committed to a practical rehabilitative approach.
Right, yes. So it's this pacing approach that's sort of key to it. So, so if a cognitive therapist is available, would you suggest that sort of...
A cognitive behavioural therapist, absolutely.
Yes.
So I think initially it's really important to focus on the behaviour rather than the way in which people are thinking.
Right.
It's because it's a bit threatening going in directly trying to change the way in which people think.
Yes, yes.
So initially it's just a very straightforward, pragmatic approach that you need to stick with, over a long period of time, but bearing in mind that there are going to be times when things go wrong.
Yes. And
predict with the patient that they are going to have setbacks, but help them to plan how they're going to cope with the setbacks as and when they occur.
Yes, yes. Now, the other situation that myself and my partners in my practice often find is that people go to the ME Association and they get lots of advice off the internet and newspapers and things, and they come in with a whole wealth of different agencies that they'd like to be referred to. But presumably it's more appropriate, really, to contain it.
Yes, absolutely.
And keep it simple in the way that you've just described, is it?
I think that's really important. I think if the patient's being investigated by a number of different specialists, then it's going to be difficult to engage them in this sort of rehabilitative approach. So I would try and negotiate with the patient, actually stopping that process of having more investigations, which obviously is not always easy.
No, but that's very helpful. Now, then, to summarise, really what I think we've discussed is that people can be taught how to relearn or to change their behaviour and their sort of physiological processes in a way that can actually control chronic fatigue syndrome.
Yeah,
is that correct?
That's absolutely right. And in fact, that's not really different to most other illnesses. If somebody's got diabetes or heart disease, then essentially the health professionals are teaching people how to cope with their symptoms and disability.
Right.
And we know that the degree of pathology is not necessarily correlated with the degree of disability.
Right.
You know, so I think our
Yes.
job generally is about helping people cope.
Yes. Despite the fact that we've seen all these techniques that can be used, it does remain that a lot of GPs feel a bit pessimistic with these sort of patients. What do you think?
Well, I think it's true that GPs and doctors in general feel pessimistic about patients with chronic fatigue syndrome, but I think it's misguided pessimism. I think there's absolutely no reason for them to feel pessimistic at all, in that I've been seeing patients for about 13 years. Most of them have been extremely rewarding and who have made significant improvements, both in terms of their symptoms and disability.
Right. What percentage would you expect to get better?
About 70% in hospital populations, which is actually very good.
Right. Over what time would that be?
Well, it's obviously not going to be an overnight cure. It's going to take several months and sometimes up to a couple of years. But if you persist with it, don't give up and recognise that there are going to be ups and downs,
Right. Yes.
then patients will get better.
And if they're left untreated, well, the converse must be the case, surely.
Yeah, left untreated patients certainly don't get better and they deteriorate.
Right. Chronic fatigue syndrome patients are difficult. We hope that you will persevere with them. It helps to arrange firm follow-up and not to expect too much. Change often occurs over the long term. We've included with the package some guidance on using role plays to develop your skills in working with these patients, because we've found that it's only by rehearsing the skills that you need that you'll be able to use them when faced with the real situation. All that remains now is to wish you the very best of
Try and negotiate with the patient, actually stopping that process. you know,
Yes.
of having more investigations.